Thank you for joining us for our webinar, How Coronavirus COVID-19 is Currently Treated with TCM in China, featuring Dr. Chen. I'm Carl Schwartz, Lhasa OMS's Chief Customer Officer. This webinar is co-hosted by Lhasa OMS and the Pacific College of Health and Science, the largest acupuncture supply company and the largest acupuncture and Chinese medicine college joined together to ensure as many practitioners as possible have access to this important information. During these very uncertain times, we know how important it is to continue to share information and come together as a community through any means possible. It is this spirit that will help us navigate the current public health emergency. Almost 5,000 practitioners have registered for this webinar from more than 50 different countries. This perfectly illustrates the power of community, the need to share information, and the singular focus on healing. Together, we will get through this crisis and provide needed healthcare to millions of people that depend on us for health and well-being. As our friend Amy Major counsels, if there was ever a time to support each other, it would be now. And always, but especially now. I now would like to introduce Jack Miller, President of Pacific College of Health and Science, who will say a few words. Jack.
Thanks, Carl. It's really an honor to be able to co-sponsor this event, which to date is the largest event that I know of with our community. It's always a pleasure to work with Dr. Chen. He's been a longtime friend of Pacific College and Pacific Symposium, where he's always been very prompt with the information we need from him and has always demonstrated the highest level of professionalism when he's ever done any events for us. So it's just a super honor to be involved with the project. Back to you.
All right, well, thank you very much, Jack, and thank you to John for graciously offering to share the most recent research that you've done. TCM has been utilized during the health crisis in China. We don't want to waste any of this valuable time, so we just have a few housekeeping items to mention. So we do have a maximum number of attendees of 1,500 people for this webinar. So if you leave the room during the webinar, there's a good chance you will not be able to get back in, and we do apologize for the inconvenience this causes. If you are not able to return to the room live, 5 minutes after we conclude the webinar, each of you will receive an email with a replay link and a copy of the slides. Also, this Saturday, March 21st, Dr. Chen will be sharing this information again, hosted by the Pacific College of Health and Science. Please check your email right after we conclude for the registration link, and it was also in the emails that you received leading up to the event. Our recording will last for 2 hours tonight, and with so many attendees, we are unlikely to answer every question tonight. In the event we don't answer every question, we will send them to Dr. Chen to see if he will be able to answer them after the webinar concludes. And we will get that emailed out to you as soon as possible. Lastly, it is best to view the webinar in Chrome, Firefox, or Safari, as you may experience slowness in other browsers. If you experience any technical issues with sound video, please check to make sure that you've allowed your speaker and video access to Livestorm. For technical difficulties, we also suggest refreshing your browser window or switching to another browser if the problems persist. Now for our featured speaker. Dr. Chen's participation in the family tradition has led him to become a recognized authority in both Western pharmacology and Chinese herbal medicine. Dr. Chen is currently a member of the Herbal Medicine Committee for the American Association of Acupuncture and Oriental Medicine. He is an herbal consultant for the California State Oriental Medical Association and is on the Review Editorial Committee for the American Herbal Pharmacopoeia, the University of Arizona Integrative Medicine Program, and the American Academy of Medical Acupuncture. Please join me in welcoming Dr. Chen.
All right, it's good to be here. Thank you to Lhasa OMS and Pacific College for helping to sponsor this webinar. I have been doing this research for quite some time, and it is my pleasure to share all that information with you. All right, so I guess the first thing I need to do, Carl or Jeffrey, is how do I see my PowerPoint instead of my own? Here we go. All right, so I have a tremendous amount of information that I want to share with all of you today. In fact, I have 136 slides. So I will be more than likely speaking a little bit faster than usual. And all the information, all the slides are already there on the PowerPoint. So you should be able to follow, hopefully without any problem. Okay. And I have also included all the information at the eLotus website as well. So if you need to download this PowerPoint, if you access any of the previous articles or interviews that we have done, you can download the PowerPoint, then click on the web link, and it will take you right there. Okay, so these are the main information from there. So with that, let's go ahead and get started. We have a lot to cover today. So what we're going to do today is two main things. The first thing is we're going to spend a brief amount of time to cover the basics of coronavirus as well as Western medicine and how Western medicine approaches treating COVID-19. And then we will spend most of the time to cover how COVID-19 is currently treated with TCM in China. Okay, so that should give you a good overall picture on how to look at this from both Western and Eastern perspectives. All right. So first is the biology of coronavirus. Coronavirus is an RNA virus. There are quite a few strains of coronavirus out there. Fortunately, most of them really do not do any harm to human, or if they do, generally speaking, it's a mild cold, mild infection. Okay, there are a few strains that tends to be more harmful to human, and there are two, I think for purpose of today's lecture, that are the most important. One of them is the original SARS-CoV. So that's a severe acute respiratory syndrome, coronavirus, and the disease that it caused was the SARS. And this was obviously a big pandemic back in 2003, 2004. So now we are in 2020, and this new strain is called SARS-CoV-2. So that's the name for the virus itself. And the disease that it causes is called COVID-19, which is coronavirus disease from 2019. And the reason this is important is because these two strains of virus are in fact 90% identical as far as their genome is concerned. All right, so that means they share a lot of similarity of their structure, and also they share a lot of similarity in the disease that they cause. And what happened is, if you look at this coronavirus, right, it has a lot of proteins on the outside that looks like crown, and that's why it's called coronavirus. And then what happened is, those are the spikes that once they enter the body will attach the lung receptors. All right, so the spike is what allows the virus to attach to the lung receptor, enter the host cell, and then begin to replicate. Okay, so for that matter, once again, both of these viruses are very similar. They both attack the lung. And if they do cause fatality, mostly it's because it caused such severe damage to the lung first, and then that transfers to the rest of the body. All right. So the general background is that the incubation period is between 2 to 14 days. The average is about 4 to 5. And most of the patient will have a very general signs and symptoms of the respiratory tract, including fever, dry cough, sneezing, runny nose, sputum production, nasal congestion, shortness of breath, lethargy, muscle aches and pain, headache, dehydration, and so on. So in most cases, what happens is they may be asymptomatic, or they have a very generic or non-diagnostic signs and symptoms. All right, so in the beginning, that's quite hard because a lot of people may just think they have a common cold or influenza. They think they rest at home for a few days and they will be over it. And for a lot of people, that may be the case. But then for people that have pre-existing illness, or they are older, or they are weaker, then it may turn into something a lot more serious. All right. And while most of the signs and symptoms are related to the respiratory tract, 5 to 10% of the patients do show GI signs and symptoms, mostly diarrhea or nausea. And this usually happens before they start to have fever and dyspnea. All right. So what happened is, if it's a mild case of signs and symptoms, more people recover and they are done. And hopefully that's the case for everybody. But then what happened is some of the patients do have the virus that go from the upper respiratory tract and they start to infect the lung. So at that point, they start to have pneumonia. They start to have shortness of breath, difficulty breathing, and so on. And the mild pneumonia may go into severe pneumonia. And the severe change of the prognosis of the patient is if cytokine storm is initiated. And this happens usually as a result of the virus starts to multiply and grow out of hand. And then immune system, in trying to deal with this, overreacts or react in an uncontrollable or dysfunctional manner and starts to attack the healthy tissue. They start to produce a lot of cytokines. And these cytokines are the pro-inflammatory signals. So now what happens is, instead of having some inflammation in the lung ends up with severe inflammation. Okay, and the inflammation is not just in the big part of the lung, like the trachea, but it's down deep to the small air sacs, the alveolar space. So now what happens is the patient would show severe signs and symptoms, like severe shortness of breath, inflammation of the airway, and finally, this is going to lead to acute respiratory distress syndrome. And as the lung is unable to breathe, is unable to get the oxygen into the body, the rest of the body becomes hypoxic and organs start to fail because they are not getting enough oxygen. So finally, you may end up with multiple organ failure, and eventually that is mainly what causes the mortality. All right. And in addition to the hyperinflammatory injury that, like we mentioned, right? So there's a lot of inflammation in the lung leading to the patient unable to breathe. What also happens is the patient suffers both physical and physiological damages. The physical injury or physical damage is the damage to the lung itself, damage to the alveolar space, and also the hyaline membrane. And obviously, when the physical or the anatomy is injured, the physiology is not going to be the same. So when the lung is injured, then obviously the patient would have signs and symptoms such as wheezing, shortness of breath, and so on. All right, so this is a disease that causes both anatomy and physiology, form and function damage to the body. All right, and then what happened is in a couple of cases in which they did do a biopsy on these patients, what they found is that in a normal patient, the lung is like a sponge. It's very soft, it's really flexible, and therefore, when you breathe, it's able to expand and contract and get a lot of air. But in a patient that has severe COVID-19 type of pneumonia, what happened is inside the lung, there is severe edema, there is a lot of proteinaceous exudate, there is hyperplasia of the lung cells, a lot of the inflammation, and also fibroblastic plugs are noted in the airspace. So what that means is there's a lot of phlegm and sputum and change to the lung cells at deep inside the lung. All right, so at this point, lung is no longer soft like a sponge, but it's somewhat rubbery and it's very, very hard to stretch. So that is what happens to the patient's actual lung when they suffer from the ARDS, acute respiratory distress syndrome. Okay, so again, it's not just a physiological change, it is a significant physical change. As far as diagnosis from a Western medicine perspective, obviously they need to do history intake as well as the early signs and symptom evaluation. So if the patient has been to a hot zone sometime in the last 14 days, and they are starting to show fever, shortness of breath, fatigue, those type of signs and symptoms, then these patients could have been exposed to the coronavirus. And obviously that's somewhat generic, so they will do something more specific. So the testing will then require a nasopharyngeal swab, and then they send it out to testing, and generally speaking, within 24 to 48 hours, hopefully they will get the results back, either to confirm or rule out the diagnosis. And then if they're hospital, they will also do chest x-ray and CT scan to see if the lung is affected. All right, so this is how Western medicine confirms or rule out whether the patient has COVID-19 or not. And also, if the patient are admitted to the hospital, more often than not, they will also do a CBC, which is complete blood count. And for the CBC, what generally notice is that 80% or so of the patient will have lymphopenia. So that's a decrease of the lymphocytes, basically your immune system. All right. And also, a lot of the patient may also have mild thrombocytopenia, and they have low platelet counts. And low platelet counts is actually a very poor diagnostic sign, because if they have low platelets to start, then what happens is as they start to have pneumonia, shortness of breath, decrease in oxygen intake, then it's even harder to bring the oxygen to the rest of the body. All right, so low immune system, low white blood cells, low red blood cells, and platelets obviously are poor prognostic signs for the patient. And obviously, these are the patients that may already have these conditions before they have COVID-19. Okay, so that's what makes them more susceptible to catching the disease. And also, once they catch the disease, it makes the prognosis a lot worse. All right. So now, once the patient are diagnosed, these are some of the common drugs that are frequently prescribed to treat the patients. Okay. Generally speaking, for fever, for muscle aches and pain, you have either over-the-counter or maybe prescription strength type of drugs are prescribed, including acetaminophen, which is Tylenol, aspirin, and also ibuprofen. And in fact, just in the last 2 days, the recommendation has changed. I finalized the presentation on Tuesday. But I think it was on Wednesday, French doctors noticed that use of ibuprofen, in fact, may worsen the condition of COVID-19. And then on Wednesday or Thursday, WHO concurred. So right now, at this point, patients are recommended not to take ibuprofen on their own if they have early signs and symptoms of coronavirus, and let's say they are quarantining themselves at home. The recommendation is they should not take ibuprofen on their own. All right. And for the patient that are in the hospital, what happened is this is what they call the novel coronavirus. So what happened is there is no specific treatment. All the things that they are using in Western medicine in a way are experimental, because they don't really know whether it's going to work or not. So some of the antiviral drugs that have been tried, one is I can't pronounce it. Remdesivir. I'm sorry, remdesivir. So this is originally a Ebola drug. Okay, and obviously Ebola is no longer a concern. So they are trying to use this drug and see if it's working for the patients or not. And lopinavir and ritonavir are HIV antiviral drugs. Okay, and they actually started to use this in China back in early February or so. And in fact, once again, like I mentioned, the information changes very fast. I think it was yesterday that I read that the Chinese government or the Chinese hospitals that was doing the study concluded that the combination of these two antivirals were ineffective. So the 190 or so patients that took these two drugs, they do not show any improvement compared to people that did not receive these two drugs. So I think what's likely to happen in the month to come is that the standard treatment will change very quickly. And in fact, there's really no standard treatment at this point in time. Chloroquine is an anti-malarial drug that originally comes from a tree bark called the chinchoma tree. Okay, so originally it was used for treating malaria. Right now, they are trying to see if this drug will work to slow down the entry of the virus into the human body. Okay, in fact, Donald Trump is trying to get the FDA fast track and test this drug and see how it works. So we'll see in the month to come. Steroids is obviously a very powerful drug as an anti-inflammatory. Okay, so if the patient has a life-threatening asthma or life-threatening type of inflammation, it could be life-saving. But the drawback of using steroids is that it is also an immune suppressant. Okay, so what may happen is on one hand, you may reduce the inflammation. On the other hand, you may suppress the immune system to a point where the patient may enter secondary infection, secondary bacterial infection or other viral infection. Also, use of steroids have been shown to increase the viral shedding, and that means these patients will then more likely to pass the virus to other people. So those are the pros and cons of using steroids. And if the patient is at risk of cytokine storm, basically that is a autoimmune-like condition where the immune system is attacking healthy cells, then anti-cancer drug or immunosuppressants may be prescribed. And for patients that have trouble breathing or have pneumonia type of things, then ventilator or respirators are definitely used. And then finally, for life support, ECMOs are also used. All right, so these are some of the standard Western medicine treatments. Some of the less common is something called the convalescent plasma or convalescent sera. And it is for some patients that have gotten COVID-19 and recover from it. Okay, one reason is they internally produce antibody to fight against the virus and kill the virus. So once they recover, what has been done in the past and what they're trying now is to get the blood from these patients, okay, and then collect that antibodies and then use it to treat patients who are just now getting the COVID-19. Okay, so this is the same concept that has been used to develop antibodies, to develop vaccines, and also to develop antivenoms in the past for Western medicine. And this is also the same concept that TCM has used for a long time to treat various poisonous conditions. All right, and that is to drink the blood of animals that are immune to certain poisonous plants. All right, so this is definitely something that is quite common in the old days. Okay, and once again, because this is a novel coronavirus, there's no known treatment or cure. Then what happened is Western medicine and Chinese medicine are both doing a lot of trial and error, trying to figure out what is the best way to treat COVID-19. All right. So in the end, what's going to happen is there are really only two ways to cure this disease. One is for most of the population at some point in time to develop their own immunity. Okay. But if you go with that path, then what's going to happen is that's assuming that the virus continues to spread, most people will get it, and at some point in time, they have to develop their own immunity. Okay, kind of like chickenpox. And the other is we have to wait for vaccination. But unfortunately, vaccination, according to Dr. Fauci, is at least a year to a year and a half away. All right, so in between now and then, there's going to be a lot of trial and error. There's going to be a lot of experimentation. There's going to be a lot of lifestyle changes that we'll have to employ to try to slow down the spread of the disease as much as we can. All right. So during this time, the general prognosis is that at some point in time, up to 50 to 70% of the people will get COVID-19. And this is what the scientists have told the German Chancellor Angela Merkel, and this is what she told the German citizens. And I would say this is most likely the same for the people in Europe, for the people in Asia, and also in America, because we all more or less live the same kind of lifestyle, right? We all go out, we all interact with other people at some point or another. And even if you have a lockdown, like what they had in China, like what they are doing now in Italy and other countries, what happened is you're locked down the country for 30 days, okay, or longer, but you cannot lock it down forever. So at some point, the lockdown will have to loosen. And once the lockdown loosens, people have to move, then you end up with a secondary wave of COVID-19. And this is obvious. This is actually starting to happen already. You know, China, Taiwan, Singapore, they are getting imported case of COVID-19. So before they had a country under lockdown, then they loosened it, but now they are considering to lock down again, or at least close off the border so they don't get imported case of COVID-19. All right, so I think this is one of the more negative aspects of what we're going to face, and that is lockdown will work, but we are likely to see slow waves basically come back and forth, and it's not likely to end anytime soon. Anyways, so the estimate is up to 70% of the people will get COVID-19 at some point in time, but fortunately, most of the patients will have only mild signs and symptoms. They don't require any medical attention, and they are not counted. And most of the infected patients, up to 80%, don't get significantly ill and don't require any hospitalization. And within that population, the young individuals, especially patients under age of 18, make up only 2.4% of all reported cases. All right, so the exact reason we don't quite yet know, but for some reason, once again, people under age of 18 are least likely to get the disease. But what that means is individuals over 60 years of age, especially ones with pre-existing health conditions, such as asthma, congestive heart failure, heart hypertension and diabetes and so on will have the highest risks. And then among the patients that are hospitalized, 10 to 20% will be admitted to ICU, 3 to 10% will require intubation or some type of breathing assistance. And the mortality is somewhere between 2 to 5, 1 to 4, depending on which source you read. Okay. And what happened is even if patient pass the initial phase, okay, and they recover and they are discharged, what happened is the virus, the cytokine storm, will have severely damaged the lung, in part due to pulmonary fibrosis. That even after they are discharged, they will have extended amount of time where they have lung damage and trouble breathing. So a lot of time at discharge, they will still need the ventilator to help them with breathing. All right, so just because they're out of the hospital may not mean they are completely done. All right, so it's a quick look into Western medicine. So let's now shift gear and start to talk about Chinese medicine. And before we get into the specifics, let me step back and give you a little of the bigger picture of how TCM has dealt with epidemic diseases in the past. Okay, so the history is that for the last 2,000 years or so, and that is from the Eastern Han to the Qing Dynasty, there have been approximately 320 large-scale epidemics in China. All right, so this is something that is common and something that occurs on a regular basis. And if you look at the history today, in the more recent years, we have quite a few as well. We have SARS, we have MERS, we have right now COVID-19, we have avian flu, we have swine flu, we have Ebola, right? And all these are within the last 20 years or so. So it's about one epidemic, large scale, or one pandemic every 5 or 6 years. Okay, so the world today is like a country, because with all the international travel, it's basically the world has become a very small place, right? So what happened in China in the past is no different than all the epidemic and pandemics that we see today. All right. And if you look at the history of China, as far as TCM goes, I think there are two main theories of differential diagnosis and treatment that we have to keep in mind. The first one is called Sanghan, or co-induced disorders. Okay. And in fact, the person who developed this theory is Dr. Zhang Zhongjing, and he lived at a time during the Three Kingdoms. And it's a time that was especially tragic in China. And the reason is because with Three Kingdoms, what happened is they are always at war with each other. So there's a lot of battles, a lot of injuries, a lot of infection type of problem. But at the same time, there's a large-scale epidemic. So what happened is within a 10-year span, 2/3 population in China died. Okay, so that's how severe it was. It's almost like the Spanish flu, right? You had the war and infection all at the same time. And that caused a huge amount of human casualties. All right, and that's why Dr. Zhang Zhongjing eventually decided to study medicine. That was his inspiration. So anyways, he developed the theory of Sanghan, co-induced disorder, in which the disease starts from the exterior and then gradually move to the interior. So exterior is the yang stage. You have Taiyang, Yangming, and Shaoyang. And interior is Taiyin, Shaoyin, and Jueyin, right? So the disease goes from exterior to interior, and as it moves further and further interior, it becomes more and more serious. Okay, then you also have the opposite to that is Wenbing, warm diseases. And this happens as people move from the northern part of China south toward the southern part of China. What happened is they live in a warmer climate. They start to see a lot of different febrile disorders or infectious disorders. So the original Sanghan type of differential diagnosis and formulas did not work very well for the southern China. So they eventually decided something else needs to be done. So through many different physicians, they eventually developed the Wenbing theory. And Ye Gui is one of the main physicians that helped to develop this theory. So the theory is that these are mainly the warm diseases, and the disease will go also from the exterior to the interior, starting with the Wei, defense level, to Qi, energy level, being nutritive level, and finally Xue, blood levels. All right. So even though the terminology are a little bit different, the definitions are a little bit different, but the similarity is that they all go from the outside to the inside, from mild to moderate to severe as the further that you go inwards. All right. So keep this in mind, because as we start to talk about TCM differential diagnosis for COVID-19, it's more or less going to be the same rationale. All right. So let's look at the common signs and symptoms mentioned earlier, and let's see if we can put this into context. All right. So the early signs and symptoms, once again, are fever, dry cough, sneezing, runny nose, nasal congestion, shortness of breath, and so on. So this is very similar to the Taiyang syndrome of wind heat or wind cold. Okay. This is also very similar to the warm way or defense level type of diagnosis. All right. So if you start to see the patient at a very early stage, in Western medicine, this could be a common cold, this could be influenza, this could be different type of viral infection, it could be coronavirus. In Chinese medicine, this is mainly a wind cold or wind heat. Basically, the pathogen is attacking the way or defense level. Okay. And then a lot of these patients have pre-existing conditions. So in Western medicine, that's called lymphopenia, that's called thrombocytopenia. So lymphopenia is your white cells, is your lymphocytes. So that is mainly your Qi deficiency. And thrombocytopenia, or lack of platelets, lack of red blood cells, that in Chinese medicine is a blood deficiency. All right. So patients that have constitutional Qi deficiency or blood deficiency are more likely to have these problems, get the infection. And once they get the infection, their prognosis is worse. All right. So once again, this is how I would interpret that information. All right. And then as the disease moves from the exterior to the interior, you now have more prominent fever. You have a lot of inflammation in the lung. You have shortness of breath. What happens also in this case is this is similar to the Yangming stage. This is similar to the Qi energy level. All right. So most of the signs and symptoms at this point will be all excess: high fever, strong pulse, forced pulse, red tongue, and so on. So this is the time when your immune system is actively battling with the virus. All right. And at the same time, inside the lung, like we mentioned, during the biopsy, there is edema, there is proteinaceous exudate, there is hyperplasia of the lung cells, and there is fibroblastic plaques, right? So a lot of congestion inside the lung. And this is described as a damp and phlegm in the lung with heat or with cold. Okay, and the difference here is heat is when the lung is still trying to fight back. Heat refers to the infection, refers to the inflammation. All right, so the body is still trying to fight back. Okay, and then cold, lung cold, is the little bit later stage where the lung is becoming very congested with inflammation, with the plugs, with the proteinaceous exudate, with the overgrowth of the lung cells. So basically the lung has no space for the air, for the oxygen to go in, right? So now the patient has shortness of breath, they cannot breathe well, their blood doesn't have a lot of oxygen, all right? So their face starts to become more purple, their tongue becomes dark. Okay, so this is now lung cold. Basically, their body is starting to have lack of oxygen issues. Okay, another very important point here is that even though this is diagnosed as damp and phlegm, what happened is in most cases it has dry cough. All right, if you ask them to cough up their sputum because you want to see what it looks like, oftentimes it's going to be very difficult. And the reason is because the phlegm, the sputum, is not inside the trachea. It's not something that can be easily coughed out. It's not very watery. But rather, the damp and phlegm is deep inside the lung. It's in the air sac. It's in the outer space. So it's blocking very deep, but the patient cannot cough it out. All right. So just because they cannot cough out the phlegm and sputum doesn't mean their diagnosis is not damp and phlegm. So in this case, you have to find that from the tongue coatings. If the patient comes in with thick, greasy coating, especially if it's yellow, that tells you that the patient has damp phlegm in the lung. If their pulse is slippery, that also is an indication. All right. So once again, you need to talk to the patient, get the signs and symptoms, but at the same time, you also have to look at the tongue and feel the pulse. All right. And then if the virus then triggers the immune system to overreact or react in an uncontrolled fashion. So this is now the cytokine storm. right? The immune cells, the cytokines, the pro-inflammatory signals are attacking the lung, damaging the lung. So what happened is the infection and inflammation are still there. So those are the yang. But when the lung cells, the lung tissues, and the linings are getting damaged, now you have deficiency. So now the disease is half yang with infection and inflammation, and half yin with damage to the lung. Patient has, infection and inflammation, they have damage to the lung. It's yang, yin, and yang. So that is a xiao yang or sao yang component of the disease. Okay, so that is basically the transition. If you're able to stop it at that time, patient will get better. If it continues, then unfortunately, you will then get to the yin stage. That will then turn into tai yin, sao yin, and jue yin. So that will then be the multiple organ failure. All right, and then according to Wen Bing, that would also be the yin nutritive level or xue blood level. All right, so hopefully it doesn't get to that point, because that point is going to be very, very hard to rescue the patient. All right, so let's say the treatment is successful and the patient is able to be released from the hospital. And like we mentioned at this point, the patient will likely still have physical damage and also physiological compromises. Lung is damaged, lung function is compromised. So this is basically your lung yin deficiency and lung qi deficiency. All right, so at this time, in West medicine, they may send the patient home with ventilator if there's extra available for them to take home. In Chinese medicine, you need to keep in mind and use herbs to tonify lung yin and tonify lung qi. All right, and as far as today, so we finished looking at the history. As far as today goes, the good news and the bad news with what we're going through right now is that the good news is this happened first in China, and obviously they have dealt with this a great deal. And in fact, the rough estimate is that there have been 60,000 patients who have taken Chinese herbs, and that's about 85% of all the patients. So they have gotten a lot of information that I can share with you. So the good news is we can learn from what all the trial and error they have done in China. Okay, the bad news is a lot of the herbs that are very beneficial, unfortunately, they used it up domestically in China. Okay, so a lot of the herb that I'm going to mention may or may not be available here in the US because there's simply not enough. Okay, also, for a while, China was under lockdown, right? So what happened is there was no going in and out. So a lot of the herb, even if they are not used domestically by the Chinese patients, they have a hard time getting that out of China. All right. So as I go through this class, I will point out the herbal formulas. And unfortunately, some of the herbs will be available, but some of them may not be available. So that's the good thing and bad things. So anyways, let's go right into the actual treatment itself now. And what I'll do is I will share 3 main types of treatment protocols with you. The first one on your left is going to be the Hubei Provincial Hospital and their treatment protocol. The second one is Wuhan Union Hospital and their treatment protocol. And the last one is from the PPRC official guidance for COVID-19 treatment. All right. And the reason I want to share all 3 with you is I think they all have pros and cons, and they all have a lot of things we can learn from. Obviously, Wuhan is the city in which this all happened. So they are, in the very epicenter of dealing with this. And then Wuhan city is in the Hubei province. So the whole province also have dealt with this quite a bit. So the diagnosis protocol, the treatment protocol is very, very beneficial. And then what happened is as all these experiences pass on to the central government in Beijing, they then compile the official guidance for COVID-19. All right. And that's where these 3 treatment protocols comes in. All right. And the big picture here is that even though they are the 3 different protocols, they are, from a big picture perspective, not that different. Okay. You can roughly divide them into 4 main stages. The first one is a prevention phase. Second one is the early phase. Third one is a pneumonia phase. And the last one is recovery phase. Prevention is obviously for patients that are still healthy, that are not otherwise not affected. Okay, so these are the protocol of what they would do to help to minimize the infection. Early phase is the very early stage when they first have sore throat, mild fever, a little bit of cough, fatigue, and so on. Okay, so at this point in time, we don't know if it's a common cold, influenza, or COVID-19. All right, so this is a very early phase of the infection. And obviously, as a diagnosis is confirmed, and as it gets worse, then it becomes a pneumonia phase. Okay, and then lastly, if they are successfully treated, they are discharged, and that's the recovery phase. All right, so despite the difference of differential diagnosis within these phases, the big picture is the same. Okay, and that's what we all need to keep in mind. All right, so let's go ahead and start with the Hubei Provincial Hospital, TCM, and their treatment protocol. So once again, you have prevention, early phase, pneumonia phase, and then recovery phase. And within the early phase and pneumonia phase, you also have 3 and 4 differential diagnosis and treatments. All right. So with the prevention phase, what they will recommend, and this is what the herbal formula they will give to all the patients, is this particular formula, right? If you look at the ingredients, okay, the first 3 should jump out at you if you have studied Chinese herbology. You have Huangqi astragalus, Bai Su atractalotus, and Huangfeng saponikovia. So these are the 3 primary ingredients in a formula called Yu Ping Feng San Jade windscreen powder. All right, and jade windscreen implies that it applies a physical barrier between you, okay, and your surroundings. So this is to imply that this will help to keep you safe. This will help to block out the foreign pathogens. So in a way, similar to the Western approach of quarantine, of masks, gloves, hazmat suits, and so on. Okay, so think of Yu Ping Feng San as literally the herbal equivalent to protect you from the environmental pathogens. All right, but the formula does not stop there. They added a few more ingredients. One is Myanmar Guanzhong Dryopteris. One is Jininhua Lanesra flower. So both of these are herbs that clear heat and eliminate toxins. So they are frequently used to treat various type of infection, viral infection, and also to some cases bacterial infection. But these 2 herbs are generally speaking much better for viral infection than bacterial infection. And then finally, you have Chen Pi, orange peel, and also Peilan eupatorium. So this is to move lung qi and also to resolve dampness in the lung. So the idea behind here is you want to tonify and attack at the same time. Okay. You want to tonify the body so the body has a sufficient Wei Qi to best fight off the virus. But at the same time, we know that 70% of all of us are going to be exposed to the virus at some point in time. All right, so our own immune system may or may not be enough. If we can add some herbs to clear heat and eliminate toxins, or in other words, these are the antiviral herbs. If we can add in some antiviral herbs, then we have our immune system and antiviral herbs trying to fight off and protect us at the same time. That should be a lot more effective. All right, so that is the goal, that is the approach behind how this formula is composed. All right, and these are the acupuncture recommendations for prevention phase, basically to do moxa for 10 minutes for each of these points. All right, if the patient is exposed to the virus and they start to show early signs and symptoms, these are the differential diagnosis and signs and symptoms and the corresponding treatment. So this is for early stage of wind cold invading the interior. So the patient had fever, mostly low grade, aversion to cold, chills, headache, ticklish throat, soreness soreness of the muscle and limbs, no sweat, night sweat. So lung CT is negative. So basically the infection is at the exterior. It hasn't affected them. So the treatment protocol is to release the wind, release the exterior, clear heat, and eliminate toxins. All right. The treatment is mostly based on a Sanghan, co-induced disorder type of principle. The 4 herbal formulas are Ge Gen Tang Kutsu or Pururia decoction, and Cai Ge Jie Ji Tang Pupura and Kutsu decoction to release the muscle layer. All right, so you have these ingredients here. The original formula has Ge Gen, Pururia, Ma Huang, ephedra, Guizi, cinnamon twigs as the primary herbs. And basically in Chinese medicine, these are the 3 herbs that release the wind cold from the exterior and also relieve the muscle aches and pain. And what happened is these herbs, first 5 or 6, really do not have any antiviral effect. And what they are trying to do is they are trying to help the body to help itself. They release the exterior. What they do is they actually open up the blood vessels. They increase blood circulation to the peripheral parts of the body. So the patient won't be so cold. The oxygen, the blood can get to limbs. They can get to the sinus cavity. They can get to the lung. And once the blood can get there, because they unblock the vasoconstriction, so can the immune cells, the white blood cells. All right. So historically, when Gegentang Puroria decoction is used, it is not to treat the virus itself, but it is really to treat and help the body to help itself. But in this case, that may not be enough because the coronavirus is quite lethal. So what happened is the modification is we need to add in some antiviral herbs. And that is why Jinlinhua Lhanisra flower is added in this case. All right. If the patient has toxic heat attacking the lung, that means most of the signs and symptoms in this case will be heat in nature. And that the heat is starting to move from the exterior and is starting to go to the interior. The signs and symptoms are fever, aversion to cold, sore and dry throat, dry cough, scanty sputum, sore and painful muscles. So as you can see, there's still some at the exterior, but it's also starting to move interior. CT scans reveals that the lung is starting to be affected. Okay, so it's no longer clear as it normally should be. The patient has red tongue, okay, yellow tongue coating, and also rapid pulse. All right, so at this point, we need to treat both the exterior, which is wind. We also need to treat the interior, which is heat and toxins. All right, so there are two formula combined in this case. Yin Chao San, honeysuckle, and forsythia powder. This is mostly to treat the heat at the exterior, and also Qing Wen Bai Du, clear the epidemic and overcome pathogenic influence powder. This is to treat the lung heat or toxic heat at the interior. So you can treat both at the same time. So remember, this is still somewhat at the early phase. The disease hasn't moved out of the exterior completely. It hasn't gone to the interior completely. All right. So at this point, the herbal formula in this case is Jinlinhua and Lianqiao, forsythia and Lhanisra. All right. So these are the two herbs that help to treat the exterior. Right. At the same time, you also herbs that treat the interior, mainly Huang Lian, Rhizoma coptitus at the very end. Right. So now this is a formula and marine herb to treat toxic heat or wind heat that is starting to move from the exterior to the interior. Okay, and obviously you have the rest of the herbs that are primarily supporting herbs. And then the patient may also exhibit damp, cold signs and symptoms. Aversion to cold, fever, absence of fever, dry cough, dry throat, fatigue, weakness, chest stuffiness, epigastric distension, nausea, and diarrhea. So now the lung is starting to get affected. There's starting to be inflammation, there's starting to be phlegm and sputum, but not quite that severe yet. All right, so you to expel the wind, release the exterior, and also dispel damp cold at the same time. So this formula here is mostly a formula to get rid of damp and phlegm, open up the lung, and dispel cold. Okay, so mainly to help the lung to help itself. And the reason I say that is because, once again, most of the herbs here, if you look at the first few, right, you have Changchu, attract the lotus, Chen Pi, orange peels, Houpu, magnolia bark, Huoxiang, Pogostemona, that mainly are used to strengthen the spleen, move the qi, and eliminate damp. This is basically to help the lung get rid of the damp. Then, of course, another very important herb is Ma Huang, ephedra. It's an herb that dilates the lung, open up the airway, and help the patient to breathe, right? So once again, this is a formula. I will look at it as a supportive formula treatment. So it helps the patient to help treat the disease. It doesn't really treat the virus itself, but what happens is if the lung is congested, if the patient cannot breathe, then the immune system will have a hard time beating the virus. So if you can help the patient to breathe better, reduce inflammation, and so on, the patient will feel better and will be better off to fight off the virus on their own. Okay, but this particular formula really doesn't have heat-clearing herbs that treat the virus itself. All right, and then as far as acupuncture protocol is concerned, You can massage those points for about 15 minutes. Okay, twice a day, once in the morning and once in the afternoon. All right. So generally speaking, the treatment goal is obviously to prevent the patient from catching the infection if possible. And if not, obviously try to stop it at the early phase before it really starts to affect the lung. And if not, then what happens is once it goes into the pneumonia phase, this is now describing the 10 to 20% of the patient that need to be hospitalized. All right, because now the patient has a serious infection that require medical intervention. Okay, with both TCM and also Western medicine case. So in this case, there are 4 primary TCM diagnoses. The first one is going to be the Shaoyang syndrome with damp. All right, so once again, like we mentioned, the disease now starting to move interior. Okay, and it's no longer just wind heat or wind cold. It's no longer just lung heat either. The heat in Chinese medicine is starting to damage the yin, is starting to dry up the fluid, and also is damaging qi. So what that means is when it damages yin, that means the lung structures is starting to affect it. When it affects the qi, or when the heat affects the qi, that means the patient is likely to have lung signs and symptoms. All right, so signs and symptoms are here, as you can see: fever, alternating chills and fever, cough, sometimes absence or wheezing, but sometimes they have shortness of breath, bitter taste in the mouth, dry mouth, chest stuffiness, stifling sensation, feeling of fullness and distension in the chest and hypochondrium. And this is similar to the beginning stage of pneumonia. Okay, if patients get a CT scan, it will show that both lungs starting to show ground glass opacity, start to look cloudy. Okay, the tongues and paws is that the patient will have red tongue, thick, greasy tongue coat, yellow tongue coating, and also slippery and rapid paws. All right, so like I mentioned, the patient may or may not be able to cough up any sputum. Okay, and the reason once again is because it's not a very watery type of dampened phlegm. It's a very thick, dry type of dampened phlegm where the inflammation is deep inside the alveolar space, deep inside the air sacs. So you have to get that inflammation from the tongue and paws, from the thick, greasy, yellow tongue coating, from the slippery, rapid paws. Okay, so this now is a Shaoyang syndrome. So we need to harmonize the Shaoyang syndrome and also clear the damp heat. All right, so the treatment protocol is to use 3 formula combined and modified. First is Xiao Cai Hu Tang minor bupleurum decoction. So this is the formula that harmonizes the Xiao syndrome and slowly move it out of the body. Okay, so stop the interior progress of this disease and starts to move it outwards. San Ren Tang is a 3 decoction, and this is a formula mainly to eliminate the dampened phlegm in the lung and help with breathing. And then Gan Lu Xiao Du Yin Sui Diu formula, special pill to eliminate toxins. So anytime you see the word eliminate toxin or Xiao Du, that means when we eliminate toxins, we are eliminating some type of infection or inflammation where there's a lot of pus, abscess, discharge, sores, those type of things. All right, so basically the result of infection in which the macrophage has gobbled up the microorganisms, and now it's a big glob of abscess and pus. All right, so the formula is, the primary ingredients are Cai Hu, bupleurum, Huangqin, Scutellaria, Senjiang, fresh ginger, and Banxia Penalia. So these are the primary ingredients in the formula Xiao Cai Hu Tang minor bupleurum decoction. All right, so Xiao Cai Hu Tang, as you will see quite often for the rest of today's class, is a very important formula for treating COVID-19. COVID-19, once it moves into the lung, once it starts from the heat and then turns into yin damage, you definitely see a lot of Shaoyang syndrome. So this is a formula that's heavily utilized for the treatment of COVID-19. Okay, they have a lot of seeds. You have the bitter apricot seed, which is 苦杏仁. You have 白豆蔻, which is the fructus omomi. You have 异乙仁, sementicosis, right? So that's the San Ren Tang type of rationale, that these are the seeds that will go deep into the lung and loosen up the phlegm and help to get rid of it from the body. Okay, and huasi, talcum, and tufulin, smilasis are herbs that help to clear the heat and eliminate toxins. All right, so once again, those are the three approaches. Harmonize xiang, get rid of damp, and also clear toxic heat. All right, and then during the pneumonia phase, one other common diagnosis is damp heat affecting the lung. Okay, so in this case, the patient may have low-grade fever or absence of fever, dry cough, scanty sputum, dry and sore throat, fatigue, weakness, and so on and so forth. So once again, damp is referring to the sputum, referring to the inflammation that's deep inside the lung, in the air sac, in the alveolar space. Heat is referring to the infection and inflammation. And obviously, both are affecting the lung at the same time. So CT scan, one scan will show that there's a lot of scattered ground glass or pasty, cloudy type of images on the lung. Okay, the tongue is going to be greasy and white. The pulse is going to be soft and slippery. So once again, you're going to see the greasy tongue and the slippery pulse. That's going to be your diagnostic indicator for the damp, for the phlegm that's deep inside the lung. Once again, the patient may not be able to cough up any sputums for you to see. All right. So in this case, we need to transform the dampness, eliminate the toxins, disperse the lungs, and expel the pathogens. All right. The three main formulas that are combined and slightly modified are Ma Xing Yi Gan Tang ephedra, apricot kernel, choices, and licorice decoction. So this is a formula that will help to open up the lung and get rid of the phlegm. Okay, open up the lung, bring the lung qi down, and get rid of the phlegm. All right. And then Xiao Xiong Tang is a formula from Sang Han Lun, cold-induced disorder, that's used when the disease moves from the exterior and then sinks into the lung. So that's exactly what we have here. Disease that starts out as an exterior wind cold or wind heat, then sinking into the lung in the form of pneumonia. All right. So that's called Xian Xiong Tang. And then Cao Guo Zhimu Tang, Cao Guo and Anemarina decoction. So this is a formula that's primarily to clear the deficiency in the body. All right. So once again, Ma Huang is the main ingredient in this case to help to open up the airway. Xingren, apricot kernel, Ammoniaca is to direct the lung qi downwards. Then you have Huang Lian coptis and Ban Xia Panelia that are important ingredients to treat when the disease sinks into the lung. Okay, and then Cao Guo, fructus, Cao Guo, and Zhimu Anemarina are to clear the deficiency heat. And then finally, they also add a very important herb called Yu Xing Cao, which is Herba houtenania. This is a great herb to clear heat and eliminate toxin. It's also a great herb with anti-viral effect. All right, so that is how this formula is composed from three separate formulas combined together and also slightly modified. Okay, and then the last of the pneumonia phase is the toxic heat or toxic stagnation obstructing the lung. So once again, when you hear the term toxic or toxin, it's describing the infection and inflammation in which there is a lot of pus abscess. But once again, the pus and abscess very deep inside the lung. They may or may not be able to cough it out. So the signs and symptoms are coughing, stifling sensation, stuffiness, distension in the lung, asthma and wheezing worsened with any physical movement or exertion, accelerated respiration, irritability, and so on. CT scan reveals that the lung is affected. Fibrotic change of the lung is starting to become visible. So this is becoming more serious. That it's no longer just a physiological change. There is physical change to the lung tissues. Dark purplish tongue. So the body is starting to not get enough oxygen. There's blood stasis. There's a lack of oxygen. Yellow dry tongue coating, thick and greasy tongue, yellow tongue coating, and rapid slippery pulse. So there's a lot of heat, there's a lot of damp and phlegm, there's a lot of toxicity. All right. So we need to detoxify, arrest wheezing, transform blood stasis. Blood stasis is referring to the fibrosis of the lung, and open up the collaterals. So the formula to use is 白虎加人汤 plus 四土汤 for wild or for earth decoction. Baihu Tang is a white tiger decoction, and it's obviously one of the stronger formula to treat the lung heat. All right, so with the heat toxin, that would be the most suitable formula. So that formula would then have Sigao gypsum, and Marina as 2 of the main ingredients. And then the formula is Baihu 加人参汤, right? Is to plus 人参 ginseng. But what happened is 人参, the ginseng or the panic ginseng, generally speaking, is too warm. The 人参 has been steamed to increase the warmth. And in this case, it's not suitable because the patient has lung heat, or you don't want to increase the heat any further. And that's why when you look at the composition, Xiyangsen is used. Xiyangsen is American ginseng. Xiyangsen is in fact slightly cool. Okay, it's also able to nourish the lung, nourish in, and generate the fluid. So it's much more suitable compared to the Chinese or Korean ginseng in this case. All right, and then that formula is combined with 四土汤, the 4 wild referring to the wild crafted herbs. 土, so 四土, 土, yeah, 土茯苓, 土大黄, 土贝母, and 土牛膝, and that's where the name 四土 come from. 4 herb with 土 in the name. All right, so these are the herbs to clear toxin in the lung. Okay, and then finally, you also have a lot of herbs toward the bottom, such as 来附子, 挺栗子, that work very well to eliminate the phlegm. Okay, 来附子 is something that we are very familiar with. It's in a lot of classic formulas, but 挺栗子 not as much, and the reason is because 挺栗子 is Lepidium or Discuronium. 挺栗子 is a very, very strong herb that eliminates the phlegm. Okay, so what happens is it goes deep in the lung, and it helps to eliminate the very tough, sticky phlegm that is very generally hard to get out. And it's very powerful, it's very effective. But what happens is we generally don't use it in classic formula is because it's too strong. So on one hand, it helps to get rid of those deep, sticky, hard to discharge phlegm. On the other hand, it will also damage lung qi at the same time. Okay, so if it's to be used, generally speaking, you need to reserve it for situations where it in fact calls for it. So don't use it for just generic or mild to moderate cases. All right, and then finally, the last case is the pneumonia phase with closed interior and abandoned exterior. And this is a case when the patient has mental incoherence, irritability, heat sensations, and so on. Okay, and to make a long story short, this is when cytokine storm has set in. There's lack of oxygen in the blood, and multiple organs are starting to fail. So the patient is losing the consciousness. They are basically very close to dying. All right, so in TCM, then what happened is they use the strongest herb to resuscitate the patient, to stimulate the heart, to stimulate the lung, and that's done with 四逆加人参汤, frigid extract decoction plus ginseng, plus 安宫牛黄丸 and 止血散. 安宫牛黄丸 is calm the palace pill with cattle gallstone, and 止血散 is purple powder. But what happened is these formulas are not available in the US because they have a lot of ingredients that are simply not allowed. But at the same time, mostly we're not going to see these patients anyways. These patients are in the ICU getting Western medicine. Most likely they are on ventilator, they are on ECMO, they are on life support. Okay, so even though this is a TCM protocol, chances are for us, it's for academic purpose, it's not for clinical purpose. All right. And lastly, if the patient is successfully treated and discharged, okay, this is the recovery phase where basically they no longer have the signs and symptoms. CT scan is starting to become normal. They are tested negative for COVID-19 virus. So now they are discharged. But what happened is they still have lung damage and they still have breathing difficulties. So Western medicine, if available, they will send the patient home with a ventilator. In Chinese medicine, ideally, you also give them formulas that nourish lung yin and tonify lung qi. And that will be a formula called Sa Shen Mai Men Dong Tang, Glenia and Ophiopogonus decoction. So those are the two main herbs. Sa Shen is either Glenia or Adenophora, which is either Nan Sa Shen or Bei Shen, or Mai Men Dong, which is Ophiopogonus. So these are the two best herbs to tonify lung yin and also stomach yin. And also, if you need to tonify qi, then ren sen, or the Chinese ginseng, is used. All right. So those are the three primary herbs, and this is the formula that they use for recovering patients. All right, and these are the points to start for 15 minutes. All right, so that is the Hubei provincial recommendations for treating patients with COVID-19. Now let's go to the epicenter, which is Wuhan, and this is the treatment protocol from Wuhan Union Hospital of China. And once again, they have differential diagnosis. They have 1 to 3, they have 7, okay? But the bigger category is you have prevention, you have early phase, you have pneumonia phase, and you have recovery phase, all right? So this is a formula that is used for the prevention phase. So once again, if you look at the first 3 ingredients, you have Huangqi, astragalus, Baisu, atractalotus, and Fangfeng, Tyler, or Sapochnikovia. So once again, this is the classic formula Yu Ping Feng Sai, the J windscreen powder, right? So once again, this is the most effective and most commonly used formula to protect yourself, tonify Wei Qi. But similar to the Hubei protocol, the Wuhan protocol is, in addition to tonifying the lung qi, they also add in herb that have effect to clear heat and eliminate toxins, right? So if you go down further down the list, you have Myanmar, Guanzhong, Dryopteris, you have Lianqiao, Forsythia, you have Yuxing Cao, Houtenania. So these are the 3 herbs that have very good effect to clear heat and eliminate toxin. So once again, that's the Chinese term. The Western terminology is these are the herb with antiviral effect. Okay, and then toward the end, you also have Huoxiang, which is Herba pogostamonas or agastache. And this is for the 5 to 10% of the patient that also shows GI signs and symptoms, nausea, vomiting, diarrhea, and so on. So this is the generic formula they give to all the patients that for prevention purposes. And once again, the most important take-home message is you want to tonify the Wei Qi and also add in some heat clearing and eliminate toxin eliminating herb at the same time, because once again, 70% of us are going to get COVID-19. We're going to get coronavirus. So you want to make sure your Wei Qi is strong to fight off on its own, but you also have help from the heat clearing herbs to fight off the virus. So if you can tonify and attack at the same time, that seems to be the best strategy. All right. And if the patient catches an infection, it's now a Wen-He invading exterior syndrome. Signs and symptoms are headache, sore throat, cough, thick tongue coating, and red tongue tip. All right. So once again, this is a Wen-He from the exterior. Most of you should know that Jinhua Lanisra flower and Lianqiao Forsythia are your primary ingredients, similar to the formula in Chaoshan, which uses those 2 herbs as the primary ingredients. But what happened is Wuhan is more aggressive. Not only do they just treat the Wen-He, they add in herb to start to treat the Lang-He because they don't want the disease to move interior. So what you see here then is you have the core herb from Xiao Cai Hu Tang minor populorum decoction. You have Cai Hu populorum, you have Huangqin scutellaria, you also have Banxia Benellium. And at the same time, they add in an herb called Banlangen isatus, which is a very strong heat-clearing, detoxifying herb that also has good effect as antiviral and antibacterial herb. Okay, so this approach is quite a bit more aggressive, okay, and in part because Wuhan is right in the epicenter. So when the patients start to show Wen-He affecting the exterior, they want to treat Wen-He, but they also want to be one step ahead and treat Wen-He moving interior. Okay, so like I said, this is a little bit more aggressive than the provincial, Hubei provincial approach. All right, and then if the diagnosis is damp warmth in the early phase, the patient has muscle aches and pain, poor appetite, low-grade fever, and so on. Okay, not only do they the damp warmth. So if you look at the ingredients such as Changchu atractalotus, Fuling poria, Juhong, that's like Chen Pi, orange peel, hope, magnolia cortex, and so on. Those are the herbs for getting rid of the dampness. What they also do is they add in herbs that also have antiviral effect. So once again, they use Jinninhua Lanisra flower. They use Lianqiao Forsythia, right? So it's not just a supporting treatment like we see earlier. It's not just a formula to help patients help themselves. They are more aggressive in Wuhan that they treat the damp, but but they also treat the virus, and they use herbs that have antiviral effect at the same time. And again, they use the core herbs from Xiao Cai Hu Tang, and they use Cai Hu Populorum, and they use Huangqin Scutellaria, because once again, they don't want the disease to move interior and the patient keep on worse. Okay, so most of these herbs are ones that you probably are familiar with. So let me bring your attention to an herb that you probably don't know. And that's the last herb here called Hong Jing Tian, which is rhodiola. Okay, and rhodiola has a very interesting application, and that is in China. This is an herb that's quite frequently used in Tibet. Okay, and what happened is a lot of people like to go visit Tibet, but they have trouble with altitude sickness, right? Because when you go so high up, you don't have enough oxygen, they start to get sick. So Hong Jing Tian has been shown to be the best herb to help the patient adjust to altitude sickness, okay, where there is lack of oxygen. That is obviously a common problem in COVID-19 patients, right? They start to have pneumonia, their lung is inflamed, the alveolar sac and air sacs are blocked. They cannot get air into their lung. Okay, so the experimentation here is they add in Hong Jing Tian to help the patient get more air or oxygen into their lung, or at the very least, adapt to the condition better. All right. If the diagnosis is DAMP obstructing the lung, the patient will have DAMP, they will have shortness of breath, they will have dry cough, and many of the other associated signs and symptoms. So once again, to treat the damp and heat, you have herbs such as Yizhen Coises. You have herbs such as Donggua Benicasa. You have Jiegeng Platycodum. So these are a lot of herbs that get rid of the damp. You also have many herbs that help to treat the heat. So once again, on the upper right-hand corner, you have Cai Hu Populorum, Huangqin Scutellaria, and so on, that help to treat the Xiaoyang stage, right? You also have Yu Xing Cao, Huttanania, and Lian Qiao Forsythia, that are heat clearing and detoxifying herbs that treat the virus. Okay, so once again, Wuhan, their approach is quite aggressive. They use a lot of herb, not just to treat the damp and support the patient, but also a lot of herb to directly attack the heat, attack the virus, and so on. And again, Hong Jing Tian rhodiola is used here to help the patient adapt to a condition where there's lack of oxygen. All right. And then if the diagnosis is epidemic toxin blocking the lung, then once again, this is a phase where there's a lot of pus, abscess, discharge, mucus, and so on. Basically, this is a severe case of pneumonia. It's ARDS. Patient have severe difficulty breathing. They have asthma. They have wheezing. They have severe hypoxia. Their tongue, their face is starting to become dark due to lack of oxygen. All right, so once again, we need to use Tinglizi, which is Lepidium and Descurania, to go deep into the lung to get rid of the tough, sticky, stubborn phlegm. So Tinglizi is generally used for difficult situations like that. Then a lot of herb to also loosen it up, right? So if you go further down, you have Yizhen, Semencoises, you have Donggua, which is Benicasa, you have Taozhen Persica. So these are a lot of the seeds that help to loosen up the phlegm for the body to eventually be able to get rid of it. Okay, and then at the same time, a lot of herbs that clear heat and eliminate toxins. Yu Xing Cao Huttanania, Jin Yinhua Lanisra, Sigao Lian Qiao, and so on and so forth. All right, and then finally, once again, the patient ends up with closed interior and abandoned exterior. So basically, the body is starting to separate. The organs are starting to fail. All right, so this is a multiple organ failure phase. Once again, there's really not much you can do. The TCM protocol is 四逆加人参汤 plus 安宫牛黄丸. So this is basically the same as a Hubei Bensil approach. Okay, using the herb to stimulate the heart, stimulate the lung, and also resuscitate the patient. And Wuhan, in this case, like I mentioned, is more aggressive. Not only do they use the herb orally, they also use the herb as injectable. So they use intravenous infusion of Sen Fu injection. So Sen Fu is Rensen, Panax, Ginseng, and Fu is Fuzi, okay, or Seng Mai San. Basically, they use herbal injectables to get a large dose of herbs right into the patient's blood circulation. Okay, so that may be good for academic purpose, but we're just not going to be able to do that in most of the European countries. or US and European countries. All right. And then finally, if the patient is discharged, okay, now the diagnosis is they are leaving the hospital with lung qi and lung yin deficiency. They have weakness of the spleen and lung. So the bottom line is they're tired, they are fatigued, they have trouble breathing. So you need to tonify the lung, tonify the spleen, nourish qi and nourish yin. Okay. And the formula, the name is not here, but it's same as the previous example. It's basically Sa Sen Mai Dong Tang. Glenea and Ophiopoconos decoction. Basically, the first two ingredients are the key ingredients. Sasen, Glenea, and Adenophora, and Mai Mendong Ophiopoconos. And once again, these are the two herbs that nourish lung yin and stomach yin. In this case, the formula uses Qi Yang Sen, American ginseng, to tonify qi. Because once again, the Chinese or Korean ginseng may be too warm and too hot, and that may not be good initially for somebody who has inefficiency. So they chose Qi Yang Sen in this case, which I think is a good example. But the bottom line is most of the qi and yin tonics should be good for the patients that discharged from the hospital. You will help to speed up the recovery. All right. So those first two protocols are, once again, the provincial, Hubei provincial recommendation, and also Wuhan Union Hospital approach. And then what happened is as COVID-19 started to spread to many different cities and many different provinces, and there's a, large lockdown of many province and cities. They start to treat a lot of these patients. Like I mentioned, over 60,000. The feedback then goes to the Beijing, and they compile the data, and they start to put out their official guidance for coronavirus disease. And in fact, we are now in the seventh edition of the book. All right, so within a short period of time, starting from January all the way to March, so no longer than 3 months, they are at the third edition. Okay, the sixth edition is actually translated into English. All right, so for those of you who are interested to read exactly what it is from page 1 to the end, I think there's about 200 pages or so. It's available. You can click on this link and it'll take you exactly where it is. You can also go to the eLotus website that I mentioned right at the beginning. It's a resource center, all these things that we have found and all the things that we have written and published. All right. So the official guidance from PPRC is similar, but also a bit different. Their three main categories are medical observation period, clinical treatment period, and also recovery period. All right. And then within the three sections, the clinical treatment period, they have quite a few differential diagnoses, meaning they have cold damp, stagnating in the lung. They have diagnoses such as damp P accumulating in the lung, damp poison stagnating in the lung, cold damp obstructing the lung blocked by epidemic toxin, flaring heat in Qi and Yin stage, internal block and outward desertion, and then recovery period, lung and spleen deficiency of Qi and Yin. So you can tell the terminology is a little bit different because this is translated by the people in mainland China. Okay, so the terminology they use is a little bit different from what you may be used to in the US or Europe, depending on what terminology you use. But in the end, I think you get the gist of it, right? So the big picture, the roadmap is more or less the same. Okay, but what happened is I'm not going to the details of all these as well as the formulas. And the reason is because within each of these differential diagnoses, they are quite aggressive. Also, the PPRC approach is very integrative, meaning most of the book is talking about Western medicine. Okay, so I would say about 90% of the book is talking about Western medicine. And even when they get to treatment, a lot of the TCM treatment has patent medicine that they use in China, but we have no access here in the US. And also for those patent medicine, their exact composition are not disclosed. So I think for this class perspective, that information may not be very useful. Also, within these differential diagnoses, what happens in addition to the Chinese herbs, they also, or in addition to Chinese herb as decoction, they also use a lot of Chinese herbs through intubation. They also use Chinese herbs through injection quite a bit. So I thought, once again, those are things that are great if you practice in China, but if you practice here in the US or Europe or Canada, Western countries, chances are you're not going to be able to utilize that information. So instead of going through all of them and give you exact breakdowns, I'll share with you basically the gist of it. And the gist of it in the end is they just have too many patients with COVID-19 all at the same time. There are too many patients in the clinic. It's going out the door. And they also have too many patients in the inpatient hospitals. And I'm sure all of you have heard they built one hospital within the period of 10 days. In fact, they built more than one. I think it was 2, 3. So they simply do not have the time to interview every patient, to look at their tongue and take their pulse and prescribe a custom formula. They simply don't have people to do that. So in the end, what happened is this is their generic formula that they ended up giving to most of the healthcare workers that are treating these patients. And this is also the formula they give to all the patients that start to show the early stage signs and symptoms. So basically their generic first line approach that they give to the patients. And if you look at the ingredients, it's actually quite aggressive, so it's not just for the early stage, it's not for prevention, but it's assuming that the patient has COVID-19 is going to go move into the lung. Okay, so that's what this formula really means. And the name tells you, right? It's called 清肺排毒汤. 清肺 is to clear the lung. 排 is to expel or eliminate the toxins. So it's assuming that the virus, which is a toxin, is going to infect the lung or is infecting the lung, and that you need to treat that, right? So the formula has ma huang. Well, actually, let's go to the next page real quick. The formula is basically made out of 4 formulas. It's made out of a formula called Ma Xing Gan Si Tang, which is Ma Huang, Xing Ren, Gan Cao, and Si Gao. So Ma Huang is to open up, dilate your lung. It's a bronchodilator. Xing Ren is a herb that suppresses your cough reflex and suppress the breathing. Gan Cao is an harmonizing herb, but it has very good effect to stimulate your adrenal gland and get your body to produce steroids. So it has great anti-inflammatory effect. And then Si Gao is gypsum to clear heat, to clear fever. All right, so this is a great formula for treating lung heat where the patient has asthma, wheezing, and dyspnea. And then Xiao Cai Hu Tang, minor purpurulum decoction. And this is assuming, once again, the virus will get into the lung, will damage the lung, and the patient will have a Xiaoyang syndrome. And then Se Gan Ma Huang Tang, Bialan Kamda, and ephedra decoction. And this is a formula for treating the patient that have what's called Tan Yin in the lung. So that's the invisible and visible phlegm both attacking the lung, but the phlegm is very thick and sticky and very difficult to get out. So basically like the COVID-19 pneumonia patients. And then finally, Wu Ling San, 5-ingredient powder with poria. Okay, so this is to drain the accumulation of fluid. So when you put all these herbs together, that's basically what 清肺排毒散 Tang, clear the lung, eliminate toxin decoction is. Okay, so this is the formula that the PPRC is getting or is pushing for all the healthcare workers, for all the patients that show early signs and symptoms to take. Personally, I think this formula is for a little bit later in the game, or not a game, but in the disease, where the patient's starting to have pneumonia. So that's probably more appropriate. If you use it too early, then it may be too bitter, it may be too cold, or it may start to bring the disease actually further interior. So personally, I would use this a little bit later, but not so early. Okay, these are the guidelines of how to take the decoction. Okay, and this is the data that the PPRC puts out, that of 701 patients within 10 provinces that took the herb, 130 recovered and discharged, 50 had resolution of signs and symptoms, 268 had improvement of the signs and symptoms, 212 had stabilization of the signs and symptoms. So overall, they say there's a 94% of effectiveness. Okay, so if you compare with the general stat, and that is of the 100 people that had COVID-19, about 10 to 20% need to be hospitalized. Okay, so that means 80% of the patient will discharge. They will show very little signs and symptoms. Okay, so in this case, it's a 94% rate of effectiveness. Okay, so that means what it means, I guess the take-home message, it depends on whether you believe it or not. Okay, so I think the formula is good. I think the formula is effective. I wouldn't personally quite use it for prevention, but if the patient does have pneumonia, then I think it's a good formula. But the challenge here in the US is that it's going to be very, very difficult to get the formula as is. And the reason is because a lot of the ingredients are not going to be available. And the 3 herbs that are going to be most unlikely to be here or most difficult to get, if not illegal, number 1 is ma huang, which is ephedra. Okay, and one of the questions that I usually get is, well, what substitutes can you use? Okay, and the first one that most people would ask is, well, how about the Mormon tea? And my reply is usually that's not going to work because the main ingredient in ma huang is ephedrine alkaloids. Okay, but Mormon tea does not have any ephedrine alkaloids. So if you're using Chinese herb as a substitute to relieve wheezing, dyspnea, and stuff off, then I would say the far distant second choice would be Dilong ferritima, which is earthworm, Ku Xingren, Ammoniaca, and Zisuzi perilla. Okay, so those 3 would be the far distant second. And generally speaking, I would say the difference between these herbs and ma huang is that ma huang has a direct effect to dilate the lung and relieve wheezing and dyspnea. These herbs generally are described to have an indirect effect to prevent the lung from getting worse. Okay, do you see the difference? Ma huang has a direct effect to dilate the lung and relieve wheezing and dyspnea. The substitutes prevents effect from getting worse, prevents wheezing and dyspnea from getting worse. Okay, so it's not the same, but unfortunately, that's all we have. Another herb that is most likely illegal in any of the countries outside of China is xixin, radix, and Rhizoma asarum. And the reason is because it belongs in the family of Aristolochiae and contains trace amount of aristolochic acid. But that is another topic for another day. Anyway, xixin has 2 main effects. One is to dispel exterior when cold, and the other is to warm the lung and resolve phlegm. And if you were to replace xixin, 1 herb, you most likely will need at least 2 or 3 or 4 herbs. To dispel the exterior, you can use jianghuo, tartarigium. To warm the interior, you can use a combination of ganjiang or baijiezi. Ganjiang is dry ginger, and baijiezi is synapses seed or mustard seed. And then lastly, another herb that you may not have access to is Guangdonghua, which is Tussilago or Fafara. And the reason it's not available is because it contains pyrrolidazine alkaloid. And once again, that's another topic for another day. But Guangdonghua is an herb that moistens the lung, descends qi, dissolves phlegm, and stops cough. But fortunately, there are many other herbs that have similar effect, so you should have no trouble with finding replacements, including Ku Xingren, Ziwan, and also Zisuzi. All right, so those are the 3 main approaches for treating COVID-19 in China. Okay, so hopefully I have been able to paint a big picture or give you a roadmap of where you need to go. Okay, the specific diagnosis may be different, the formula may be different, but more or less they are the same. So what happened is, I think when you treat the patient, as long as you know, when you see the picture, you know where you need to go, generally speaking, I don't think you can go too wrong. Okay, so the early phase is prevention. You know, if the patient is still otherwise healthy, if the patient may be weak or fatigued or is an elderly patient, then I think prevention is the best thing that we can do for the patient. Make sure we give them herb to tonify their body, keep them healthy, so they are less likely to get the disease. And then you have early phase of generic signs and symptoms. That could be any kind of viral infection, all right? So this is also a time when TCM is very effective. But if the disease move into the lung and they start to have pneumonia, okay, then it's going to be much harder to treat patients. And the reason is because we don't really have access to a lot of herbs, okay? These patients are confirmed COVID-19 patients, okay? So if you're going to see these patients and treat these patients, are you really prepared? Right? Do you have the mask and the goggles and the hazmat suit and the gloves to protect yourself and your clinical staff from contracting the virus? All right. If you really do have all those to 1 patient, well, you might end up treating 1 patient, but scare 20 patients away. Because if I were the patient, and this is what the doctors all wear, and I'm only going in for a low back pain, chances are I'm going to turn around and go because it may not be worth the risk. right? So once they had the pneumonia phase, once they are confirmed COVID patients, perhaps it's important to know our limitations. If they need to be in the hospital, if they need respirator and ventilator, maybe Western medicine can handle this crisis better than we can. All right. But then eventually, if they're discharged, okay, once again, the recovery phase, I think Chinese medicine is better than Western medicine, because once they're discharged, Western medicine really doesn't do much. They just tell you perhaps to go home and rest and recover. At most, they give you a ventilator. Okay. But in the US today, chances are there's no ventilator to spare. So if you can consult with these patients and treat them and speed up the recovery, then I think that's another area where TCM can do a lot to help. All right. So basically, among the 4 phases, I think TCM is very beneficial for at least 3 out of 4. Okay. And if you're interested in looking into more detail and comparing the different phase, the differential diagnosis and herbal treatments, then Loy Shu had made these charts, okay, to divide, kind of like I did on the PowerPoint, into the 3 sections. Okay, it's a little bit, it's impossible to see on the PowerPoint. But once again, if you click on the hyperlink, it will take you right to the website and you can download the charts. All right, this is the acupuncture protocol from Journal of Chinese Medicine. Okay, so for those who are interested, I will leave you to click on the link and read the article. Okay, what I want to do now is spend the next 15-20 minutes or so to talk about the research, because what happened is in China or in Asia, people believe in herbs. So it's really no problem to get them to take herbs. But what happened is in the US, in Europe, in the Western countries, some believe in herbs and some don't believe in herbs whatsoever. And also, I'm personally a pharmacist, so when I speak to pharmacists, nurses, and doctors and so on, my experience has been that you cannot just use TCM language. You cannot just say yin and yang and long heat and damp heat and damp cold. You're going to lose your audience after a few minutes. Okay, so what you need to do is speak the language they can understand. And that language is medical terms. The language is research. Okay, so what I'll do in the next 15-20 minutes is to give you the research that have been done, so you know not just the TCM terms, but also from a pharmacological and clinical research perspective, what these herbs really do. Okay, and we'll look at both single herbs, and we'll look at formulas, and we'll look at some herbs that you know, and some herbs that you probably don't know. All right, so the first herb is huangqi. Huangqi is an herb that's great for tonifying the qi. Specifically, in this case, we want to use the herb to tonify Lang Wei Qi, which is your defense qi. All right, so that's what we use, and that's the primary herb in the formula Yu Ping Feng Sai Jue Wood's Green Powder. Okay, but what you may or may not know is that huangqi has a great immunostimulant effect. So what it does is that huangqi will stimulate production of T cells, and you will activate the B cells. So what that means is T cell is your first line of non-specific immunity. So these are your macrophages. So as your T cells, as your macrophages become more active, what they will do is they will go around, they will engulf and destroy anything that's foreign, anything that's considered to be pathogenic. All right. So T cell has a great chance to identify the microorganism, the bacteria and virus in the first place. And then what happens is B cell is what gives you the antibody. It's what gives you the immunity. So once the virus has been identified by the B cells and destroyed, the B cell will have a B memory cells, okay, that will remember what this virus is. So next time, if you are re-exposed to it, your body will know right away how to handle it. Okay, so this is why you get sick one time, but you're sick again. This is why you get one chicken pox, and generally for the rest of your life, you won't get it again. So huangqi has effect to stimulate the immune system. So you have more T cells and you activate the B cells. So you get both short-term increase in immunity and also long-term protection from the B cells. All right. We mentioned about Jin Yin Hua Lanisra flower quite a bit. Okay, so this is one of the many, many herbs that clear heat and eliminate toxins. And what happens is when treating infection or when you're treating heat, it's sometimes very difficult to know out of all the herb, what is the best herb to use for the infection. What herb has antibacterial effect? What herb have antiviral effect? What about the specific bacteria? You have Staphylococcus, Streptococcus, E. coli, Salmonella, and so on. You also have many different viruses. So this is where I think the pharmacological effect is very beneficial if you know the diagnosis. So Jininhua, generally speaking, has both antibacterial and antiviral effect. But between the two, the antiviral effect is much stronger. And that's why you generally see it used for viral infections. And as far as these are the antibacterial effect and what the herb treats as far as bacteria goes. What we are more interested in, of course, is the antiviral effect. So this herb has been shown to treat various types of influenza and respiratory virus, Coxsackie virus, and so on. All right. And specifically, this is a research that shows, that studies the antiviral activity of medicinal herbs traditionally used in southern mainland China. So what this study did was they looked at 21 herbs and studied antiviral effect against influenza virus, respiratory virus, coronavirus, and so on. And what they found is that Jininhua Lhasa flower inhibits the SARS coronavirus replication at a non-toxic concentration. But what happened is the other 20 that are tested generally require much higher concentration. In fact, the concentration may need to be so high that they need to do injections. And obviously, if you need to do injections, that's not going to be very helpful to us here. So at least we know from this, number one, Jininhua works against SARS coronavirus. Okay, and two, you can take it orally and it's going to work. The next herb that we have here is banlangen, which is the Isatus root. So this herb, once again, has similar description in Chinese medicine. It clears seed, emanate toxins. Specifically, it has four main pharmacological effects that we use here. One is antibacterial, one is antitoxin, one is antiviral, one is anti-inflammatory. So antibacterial, we know what it is. It treats bacteria. Antiviral, we know what it is. It treats virus. Okay. Antitoxin means a lot of time when the bacteria or the virus is being attacked by the immune system, what happens is they break apart and they are taken up by the macrophages. But what happens is when they break apart, it looks as if millions of pieces of these bacterial cell wall and viral particles, and they get stuck in healthy tissues. And then the immune system overreacts and creates cytokine storm. So that's the over response by the immune system. To help to reduce that, you have herbs that have antitoxin effect. So this is the effect to block the over response by the immune system that triggers hyper-inflammatory reactions. All right. So banlangen and daqingye are two of the herbs, that's Isatus root and Isatus leaf, that not only treat the infection itself, but also block the hyper-inflammatory response by the infection. All right. As far as antiviral effect goes, it helps to treat many different viruses, including influenza virus, human or avian, swine virus, encephalitis virus, adenovirus, herpes simplex virus, hepatitis virus, cytomegalovirus, and so on and so forth. Okay. Also, there is specific research on anti-SARS coronavirus-like property effect of Isatus indigotica root and also the plant-derived phenolic compounds. And what they basically found is that banlangen has a direct effect to inhibit the enzyme activities of the SARS coronavirus. Okay, so once again, this is a very specific information on how the herb treats the SARS coronavirus. So up till now, we talked about three herbs that most of us should know. You have qi that tonifies qi and boosts the immune system. You have Jininhua Lhasa flower and also banlangen Isatus root, which are commonly used to treat a lot of the wind, cold, and virus infection type of problems. Yuxingcao, we also saw quite a bit in many of the formulas in the treatment protocols in China. And once again, the TCM description is that they clear heat and eliminate toxins. And more specifically, this is an herb that also has great antibacterial, antiviral, and anti-inflammatory effect. All right. So the specific effect is both antiviral, which generally means they suppress the replication of the virus, and also virucidal, which means they go in and cure the virus. So Yuxingcao has many antiviral effect and virucidal effect against herpes simplex virus, against a cyclovir, Zovirax-resistant herpes simplex virus, H1N1, influenza virus, pseudorabies virus, influenza virus, and also HIV virus. All right. And then specifically against the SARS coronavirus, Yu Xingcao shows both immunomodulatory effect and also anti-SARS virus effect. And what that means is it has an effect to inhibit the virus and the viral replications. And also it boosts the immune system, specifically the lymphocytes, to help the immune system to fight the virus. So in a way, it's almost like the prevention formula that we saw earlier. It's a formula with effect to boost the immune system, and also a formula with herbs to treat the virus at the same time. So Yu Xingcao is literally one herb that will do both simultaneously. All right. This herb is an herb called Wu Beizhi or Gala chinensis, and this is an herb that you might never have thought of as far as using it for treating infection and inflammation. And the reason is because this is what we call a binding herb, an herb that binds and restricts and has a astringent effect. And the theory in TCM is that if you use an herb with a astringent effect to treat a condition with heat or damp heat, you are going to astringe and lock and keep the damp heat inside the body, and that actually makes it worse. So generally speaking, you're not going to see the astringent herb used for treating any infection. But one is Wu Beizhi actually has shown very good antiviral effect against many viral infections, including Epstein-Barr, including HIV virus, and so on. And specifically, how it works according to this research is that it works by blocking the entry of the severe acute respiratory syndrome coronavirus into the host cells. And how it blocks the entry of the coronavirus into the host cell is that there are two compounds in this herb. One is called TGG, which stands for tetra-O-galliol beta-D-glucose, and also luteolin. So these are the two compounds that have been found to bind to the spike proteins of the coronavirus, and therefore block the virus from entering the host cells. So if you didn't know how the coronavirus entered the host cell, is that these spikes, attach to the receptors in the lung, much like the Velcro tape attached to each others. So when the coronavirus gets into the respiratory tract, it attaches to the lung cell receptors, it becomes Velcro and attached to each others, and therefore enters into the lung cells. But what happened is Wu Beizhi, interestingly, right, it had a binding effect, and it in fact binds to the receptor in the virus, or binds to the spikes in the virus. So now the Velcro becomes smooth, and it's no longer able to bind to the lung receptors. All right, so I think it's fascinating how this herb is in fact classified as a binding herb and literally binds to the spikes of the coronavirus. All right, and the last herb we'll talk about here is an herb that most of you have probably never heard of and have probably never used, called Yu Xingcao, which is Tuna sinensis. Historically, it's to clear heat and eliminate toxins from the lung to treat lung heat and cough. All right, and they have found this herb to inhibit the SARS coronavirus replications. More specifically, what it does is there's a compound called TSL1, and that simply means it's a Tuna sinensis leaf that binds to the SARS virus to inhibit the cellular entrance of the virus into the host cells. So similar to the previous herb, that it blocks the entry, but at the same time, it also inhibits the replication of the virus to help to treat SARS. So this herb does two main things to minimize the infection. One is it blocks the entry of this virus into the cell, and if it does enter the cells, it blocks the replication of the virus. And at the end of this particular study, the researchers concluded that this is one of the most effective herbs to treat SARS coronavirus of all the herbs tested in Sanghan Lun, cold-induced disorders, and Wenbing Tiaobian, systemic differentiation of warm disease. So basically, they take all the herbs in both of these books and all the herbs in the formulas, and they test in the lab one at a time, and they conclude Xiangcunye Tuna sinensis to be the most effective herb. Okay, so historically, we really don't know about this herb. I first learned about this herb about 4 or 5 years ago. Okay, and this herb, I think in the days to come, is going to catch a lot of attention because it really is a very good herb. All right. So those are the research information with single herbs. But generally speaking, when we treat patients, obviously we use herbal formulas. So the research I want to share with you is a research on 玉屏风散 J windscreen powder that we see quite often earlier, mainly for use in the prevention phase. Right. So this is a research study that was done in Hong Kong, and the title is Use of an Herbal Formula by Hospital Care Workers During SARS Epidemic in Hong Kong to Prevent SARS Syndrome Transmission. All right. And basically what they did is they went to 11 hospitals in Hong Kong and asked hospital workers who would be willing to participate in the study to take herbs. And those that do are the patient in the herb groups. Those that don't becomes the non-herb group. So they ended up with 1,063 that took the herbs and 15,374 that did not take the herb, but they were going about their business in the hospital as usual. And this is the breakdown of all the patients based on age, gender, whether they are doctors, nurses, or ancillary workers, type of work they do, and also the 11 different hospitals. Okay, and this is the formula that they decided to use. Okay, and this is the results. Okay, out of 1,063 in the herb group that took the herb, 0 were infected. Out of 15,374 in the non-herb group, 64 were infected with SARS. Okay, and the p-value is 0.035. And what that means is we can say with 90% confidence that the use of herbs prevented the infection of SARS. All right, so let me say that again. Based on this result, we can say with 95% confidence that the herb worked to prevent the infection of SARS. Okay, and SARS, or SARS-1 or SARS coronavirus 1, which is way back then, and SARS coronavirus 2 are a little bit different, of course, right? The original SARS is not as infectious, but far more deadly. SARS coronavirus 2 is more infectious, but not as deadly. Okay, but nonetheless, this formula shows that it's definitely effective for prevention. And the downside of this is 1.8% of the patient show minor side effects such as diarrhea, sore throat, dizziness, and nausea. But I think overall, this is a very small price to pay to prevent you from getting a potentially life-threatening infection. Exact composition of the formula is a combination of 玉屏风散, which is the J windscreen powder, plus sangjuyin, mulberry leaf, and chrysanthemum decoction, which is good for treating early stage of warm febrile disorder, where there's mild cough and mild fever. And then they added 2 stronger herbs to clear heat. So you have 大杏叶, Isatus leaf. So that's the root, that's the herb, the leaf counterpart compared to banlangen. And then finally, huangqin, Scutellaria, great herb to clear heat, especially from the lung. And the treatment protocol was to take the herb daily for 2 weeks. Okay, and this is the exact composition or list of all the herbs. All right, so I think this is one of the things that TCM can definitely do to help the patient, and that is to help the prevention of the infection in the very first place. All right, this here is a slide of a picture of a doctor called Wu Youxing, and this is the first doctor that started to raise the question that when we are treating warm epidemics, it's not the cold that causes the disease. It's not the cold. It's not the heat. It's not the damp. It's not the summer damp. It's rather a epidemic pathogen that we cannot see, we cannot touch, we cannot hear, but is transmitted through heaven and earth. Okay, so basically he's describing the bacteria, he's describing the virus way before the discovery of bacteria, way before the invention of microscope. And obviously back then, there's no mask, there's no goggle, there's blood. So this is a picture showing that he physically go to the first line to interview and to treat the patients. And he's basically the father of the 温病论, the warm febrile disease. Okay, this is one of my favorite slides to show anytime I talk about infectious disease. This is a little booklet called The Sanford's Guide to Antimicrobial Therapy, and they publish a new one every year. And this is also what a lot of people consider as the Bible for infectious disease specialists because it has a lot of valuable information inside. But when I first saw this about 20 years ago, I was really excited. And the reason is because of the two Chinese characters on the cover of the book. And if you flip to the inside front cover of the book, it says 热病, okay? And it gave credit, or 热病 means heart diseases, right? And it gave credit of the two characters to Huang Di Nei Jing, yellow emperors in a cloud from the 1st or 2nd century, that the heart disease that we know in TCM is basically the equivalent of infectious disease that we see today. And that many of the bitter cold herbs that we use to clear heat, in fact, are the plant origins where antibiotics come from, right? If you think about it, right? Chloroquine, that's what a lot of people talk about today, possibly as a hope for treating COVID-19. It comes from plants. If you talk about others, including penicillin or aminoglycoside, a lot of the antibiotic in between, they all come from natural sources. So what happened is bacteria and virus are living things. They don't want to be killed. So you really need another living resource, whether it's plants or animals, to really be able to keep up and fight against the virus and bacteria and all the mutation that occurs. Okay, because what happens, plants don't want to die and animals don't want to die, so they will continue to evolve along with the mutation of the bacteria and virus. And it's only the plants and animals, I think, that can really keep up with all this. All right, so now finally, where do we go from here? Okay, the infection started in Wuhan, China, of course, but it now spread everywhere. And my personal prediction is that even though China had a lockdown, they were very effective. Taiwan had a lockdown. Singapore did the same thing. Korea is a bit slower, but they were very effective. The new cases in these countries have basically plateaued out and they've stabilized. And now we see a significant increase in Italy, in Germany, in France, in England, in the United States, because we are now going through what many of these Asian countries are going through. So what's happening is you have one city and one country that are starting to have lockdown one at a time. And people from these countries are now getting scared. So what do? They now are fleeing wherever there is a hotspot. And they are fleeing. They are going outside of New York. They are going outside of San Francisco. They are trying to get out. And a lot of them are going back to Taiwan, going back to Singapore, going back to China. And they are seeing a lot of cases of import COVID-19. And what's then going to happen is once New York is done with the lockdown, once Nevada is done with the lockdown, they cannot live in that lifestyle forever, right? So they are going to slowly open up after the lockdown, and then they are going to have imported cases of COVID-19 as well. So this is going to cross and import and export, and they are going to cross infect each other's for a long time to come. And this is, I don't think it's going to end until one or two things. Either most of the people are exposed to it and develop their own immunity, right? So once again, 70% of the patient will eventually be exposed to it, or until when vaccine is ready. And that's going to be at least a year and a half away. So we all need to take part and help with this crisis. And we're going to be living like this, I think, for a little while. All right. So patient needs to practice whatever guidelines, information that CDC or WHO puts out. And that is social distancing, wash your hands, keep a distance, avoid large gatherings, and so on. Okay. Chinese TCM practitioners need to educate the public on what else can be done besides those measures, right? Those that have Qi and blood deficiency, ideally they take herb to keep as strong as possible so they are less likely to get infected. And if they are infected with early signs and symptoms, I think TCM is also very effective in this case to fight out the effective, because after all, 90% or more of the patient with COVID-19 show only mild signs and symptoms. Hopefully with herbs, we can push 90% to maybe 80% to maybe 85 or 90. So the more we can do, the better off the patients are going to be, because they are definitely not enough hospital beds in ICU to treat all the patients that may be affected. And then finally, if the patients are affected, if they are admitted to hospitals and if they're in the ICU, then generally speaking, Western medicine will be better to handle this crisis. Okay, so we don't need to be in the hospital with hazmat suit to do acupuncture or to give patient formulas with ma huang in it. I don't think that's our role. But then finally, if the patients are discharged, then we can help them heal and recover a lot faster. So once again, herbs are nourishing, herbs are tonify qi will definitely speed up the recovery. And like I mentioned, this is something that's going to be moving very rapidly. You know, I had to update my slide and my presentation many times, and I expect to have a lot more information in the days to come. So I will continue to post all this information at the Lotus website. This page is on all the Western science information from WHO, NIH, DC, FDA, and so on. And this page is for all the Western medicine information from Elsevier, Johns Hopkins University, New England Journal of Medicine, JAMA, Lancet, so on. And then this page is on all the TCM information. Okay. In fact, like I mentioned, if you are interested in any of the information, you know, the protocols from Hubei province, from Wuhan Union Hospitals, or the official COVID-19 guidance from the government, they are all here. Okay, you can go to these links, click it, and the information is all there. And then lastly, if you have any questions, if I speak too fast, if we don't have time for questions, feel free to send me an email information. This is my email address. I will try to get back to all of you, maybe not right away, but definitely within 24 hours, because this is a big issue. Okay, I will do what I can to help our community and help the patient to get through this. All right, so I think I just about used up the entire 2 hours. So we have just a few minutes, so I'll take 1 or 2 questions. So I don't know if Jeffrey or Carl is still there somewhere. So, here he is. Okay. So we'll do 1 or 2 questions. Yeah, I can hear you.
All right, let's see. Actually, we had a few questions that were submitted before the webinar. First, I have observed that those with serious illness or death had either low hemoglobin or high ferritin. Did China make efforts to control iron metabolism? I just read a study and found that those with type O blood were less serious illness, and those with type A had more serious illness. Is that true?
I haven't come across specific studies that talk about Chinese herb as far as iron overload. So I'll do some research, and if I find something, well, whoever that asked that question, get email, and if I find something, I'll reply and let you know.
All right. Well, we have basically 1 minute left. So why don't I just say thank you to you for all of this incredible information. We had 1,500 people, maybe even more, that joined for at least part of this, some of it or all of it. So we thank all of you for coming together tonight as a community. Thank you to Dr. Chen for sharing all of this valuable information. And he did it out of the kindness of his heart and just to help with, you know, this ongoing crisis. So thank you all for joining us. Do not miss out if you would like to join on Saturday. Dr. Chen will be giving a very similar presentation with the Pacific College of Health and Science, and you all will have an email to that in the email that you're going to get in 5 minutes after we end. Also, you're also going to have a replay link to this webinar. You'll have a link to the slides, so you'll have anything you need, and then anything else that you need, feel free to email us at Lhasa OMS. Dr. Chen gave you his email. Thank you again to you, and thank you to all of you. Have a great night and stay healthy.
All right. Thank you for all coming. Stay safe.
Thank you.
All right. Bye-bye.